Good morning, everybody. Can I thank the 65,000 people that came forward to get tested in the last 24 hours. That is an outstanding number, and we deeply, deeply appreciate the number of people that did that. And we need those rates to stay consistently high so that we're confident we have captured all chains of what we call community transmission. To 8 p.m. last night, New South Wales recorded 97 cases of community transmission. Unfortunately, 24 of those were infectious in the community. That is the number. The 24 number is what we need to get down to as close to zero as possible before we can end the lockdown, and I really want to make that point clear. Can I also thank wholeheartedly, and I mean this sincerely, the Fairfield community for coming out in large numbers to get tested. Can I also thank them for reducing their mobility? Data shows that the Fairfield local government area has responded to our health messages. People are staying at home, and we can't tell you how pleasing that is. But what we need to say today now is that if you live in the Canterbury Council area, Canterbury-Bankstown, or the Liverpool Council area, those mobility data is still a bit higher than what we'd like to see. So the Fairfield local government area has responded in an outstanding way. We want to make sure those adjoining council areas also respond in the same way, because we don't want to see community transmission extend to other parts of Sydney. At this stage, 3/4 of the cases are still in the Fairfield local government area. There's a smattering all over the place, including in the eastern suburbs, including elsewhere. But at this stage, given the vast majority of cases are in the Fairfield local government area, we need those adjoining council areas where people interact between to also reduce their mobility. That means stay at home. Don't leave the house unless you absolutely have to. In relation to the new testing requirements that were put in for workers yesterday, can I just make this point? Those requirements come into effect from the weekend. Please know that if you have symptoms, you shouldn't be going to work. You should be getting tested and going home until you get the health advice, until you get that result. But if you are a worker who has no symptoms and you're carrying out essential work, it's okay for you to get tested where your workplace is, near your workplace, to take pressure off all the testing clinics in the Fairfield local government area. We have put on extra staff and extra facilities, but in order to ease the pressure, including traffic congestion, if you're a worker with no symptoms but you have no option but to go at work, you can't work from home, and you're leaving Fairfield, you can get tested near where your workplace is, and there's over 400 testing clinics that people can get access to. However, we want to stress you should not be leaving home unless you absolutely have to, not just in those communities but anywhere across the stay-at-home area. You just shouldn't be leaving your home unless you absolutely have to, and I just want to make that point clear. But again, I do want to thank in particular for praise the Fairfield local government area, because the mobility data there has shown a considerable drop-off in people leaving the house, and I'm just so deeply grateful that you have responded so positively. We now need adjoining council areas to take up that message in larger numbers as well. As I promised yesterday, the New South Wales Government, based on the health advice, would provide information on the extension of the lockdown. And it always hurts to say this, but we need to extend the lockdown at least a further 2 weeks, from Friday the 16th of July to Friday the 30th of July. That includes home learning. However, we'll obviously assess the situation at the end of those 2 weeks and provide information beyond that. We are prioritising vaccinating aged care workers and teachers in those key local government areas, and Dr Chant's team, health advice, will tell us what we can and can't do beyond that 2 weeks. But I just wanted to provide certainty on behalf of the government to the community to say the lockdown will unfortunately be extended for at least another 2 weeks with the current settings. So the current settings in terms of what people can't do won't change for at least 2 weeks. Of course, if health advice changes and we need to do anything further, we will, but my message is that home learning will continue in those areas where it's home learning for at least another 2 weeks, and the existing settings will be in place for at least another 2 weeks. I want to thank the community for your patience, but please also know this is why the New South Wales Treasurer, Don Perrottet, who's with me today, and I fought so hard to get the right package for New South Wales, and why we've provided additional funding so that businesses and individuals don't stress. For as long as we need to make sure we keep our public health and safe, individuals or businesses will remain well supported. Of course, we want to see this lockdown end in a timely way, but no matter how long we do need, we will have that support for businesses and for individuals, and the Treasurer will reiterate those points of access. And that's really why we fought so hard with the Commonwealth, why the New South Wales Treasury and the New South Wales Treasurer, along with the government, worked so hard to make sure we got the right package. And I have to say the feedback this morning from business in particular has been very positive, where businesses are very supportive of the measures we've put in place, and the challenge for us is to make sure that individual workers and businesses know where they can go to get that information for that support. So again, I just want to thank everybody for the work we've been doing. We are all in this together, because no matter where we live or what our circumstances, the virus could come to us. We don't know how people are moving around. We don't know exactly what contact people have had. That's why it's important for all of us to stay at home unless we absolutely have to leave the house, and for all of us to follow the health advice. And unfortunately, the main cases of community transmission are still direct family contacts or else workplaces, and that's why we had to put in those measures yesterday to really clamp down on those two areas which are providing, unfortunately, the greatest rates of transmission, which we have to reduce. Dr. Chant will now give her update. Deputy Commissioner Warboys will give an update from police, and then the Treasurer will reiterate the opportunities we have to make sure that we get this right through the support we have for both businesses and individuals.
New South Wales recorded 97 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. The majority of the are close contacts and household contacts, but we are seeing some unlinked cases, the source of which are actively being investigated. So the pattern, as the Premier has indicated, is really household transmission, but we are seeing some transmission in workplaces. So again, a reminder, ensure that for those essential businesses that they ensure that they've got those COVID-safe practices in place. We had 2 cases of overseas acquired. Of today's cases, the vast majority were in the southwestern Sydney. So of the 97 cases, 70 are from southwestern Sydney Local Health District, and most of these are from the local government area of Fairfield. The areas of concern, and this is important, that whilst we are intensively focusing on supporting the communities in Fairfield to identify cases and to stop spread in that local government area, to keep that community safe, it is important that we don't lose focus on adjacent local government areas of Liverpool and also the Canterbury, Bankstown local government areas, but also broader Greater Metropolitan Sydney. And I just want to read out some of the areas for increased testing, and these are based on where we know that there have been infectious people out and about in the community. So I am highlighting to you that the risk is ever present. And remember, what I'm reading you today is what's happened overnight. So tomorrow there might be different sites. So that really reinforces the message that whenever you leave the house, you've got to assume that you can come in contact with someone who's infectious with COVID. So the areas of concern are Fairfield Local Government Area, Roselands, Rosebery, Canterbury, Belmore, Sutherland Shire, the St George area, Belrose, Bankstown, Windsor, St Ives, Penrith and Bayside Local Government Area. We currently have 71 COVID patients that have been admitted to hospital, and there are 20 people in ICU, 4 of whom are ventilated. Of the 21 people in ICU, 1 is in their 20s, 2 are in their 30s, 2 are in their 40s, 5 are in their 50s, 5 are in their 60s, 3 are in their 70s, and 2 are in their 80s. And the reason I take the time to read out those age profiles, it is really to dispel the misconception that COVID is mild in younger age groups. It can impact, yes, it is less likely to lead to hospitalisation and death in younger age groups, but it still can be a serious illness requiring admission to ICU. So it is important to keep our loved ones, ourselves safe and our loved ones safe, and please follow the public health advice.
Thank you, Dr. Chant. Premier, Treasurer, Minister, good morning. A very challenging situation last night at Fairfield around those testing centres. New South Wales Police deployed additional resources to that area for the one reason, that was to help out those people, to assist our friends at health, to look after the people of Fairfield, to provide them with some information, some reassurance around those queues and the testing centres and their hours of operation. We will continue to do that right throughout today, right throughout the next few days, until such times as that gets some sort of sense of normality about it. Our local superintendent will work with the Police Operations Centre, has done last night, today, and into the next few days to arrive at the very best traffic plans, the best communication plans, to work with our friends at health and local government to make sure that testing regime that has been adopted in that Fairfield area runs as smoothly as it can. I'd also like to highlight today another incident where it's a good news story, where police went to the markets at Homebush on the back of a number of calls around non-compliance. When they sat down and spoke to the organisers of that market area, 5,000 people almost every day attend there in a large space to deliver fruit and vegetables and other items, other essential items. The COVID safe plan was as good as what they've seen. Over 4,000 masks handed out every single day, deep cleaning on a regular basis, education packages handed to not just individuals but employers of those people. New South Wales Police will return there and continue to work with that large entity at the markets to make sure that they continue to deliver a very safe business product in what is a very essential part of our economy. Commissioner Fuller made it very clear this morning to the police officers through the Police Operations Centre that New South Wales Police, first and foremost, is about helping. Of course, we need to write out tickets, and I've said that every single day. 201 tickets written just in the last 24 hours, the vast majority of those not in southwest Sydney. So our message is that New South Wales Police in and around Fairfield and southwest Sydney are there to help people get through this difficult and challenging time, but we will continue to do our very best across this state to make everyone safe. Thank you.
Thank you, Deputy Commissioner. It's no doubt that it's been a very difficult and challenging and uncertain time for businesses and workers across our state. But I believe the package we announced yesterday will provide certainty for businesses and workers that we will get through this lockdown period. We've come through the last 18 months. The New South Wales economy is stronger than it was before the pandemic. We've recovered all the jobs that we've lost, and that's been on the back of businesses and workers right across the state, and together we will get through this lockdown period. Yesterday's announcement provided thousands of dollars of support for businesses right across New South Wales, whether that's the agreement we made with the Commonwealth Government to provide up to $10,000 per week for businesses right across New South Wales. We expanded our business grants program, which will provide now up to $15,000 payments to eligible businesses. And also for smaller businesses with a turnover of less than $75,000, greater than $30,000, there are payments of $1,500 per week. We are also waiving payroll tax obligations for eligible businesses who've had a turnover reduction of 30%. And we're also deferring payroll obligations for the next 2 months. This will provide important cash flow for businesses right across the board. We're also providing, as the Premier has outlined, support for individuals, where in conjunction with the Commonwealth, those workers who are still employed but have had their hours reduced are able to contact Services Australia and receive up to $600 a week as well for support during this difficult time. We've also provided yesterday important protections for tenants, whether that's you're a commercial tenant, a retail tenant or residential tenant. There will be no lockouts or evictions. As a residential tenant, there will be no forced evictions for 60 days. Mandatory mediation is in place, and also financial support. And I encourage all landlords today to speak to their tenants, whether that's retail, commercial or residential. And if your tenant is struggling, to engage with them in a payment plan, a reduction in rent, and we will provide an equivalent offset in terms of your land tax obligations. And for landlords in the residential space who don't pay land tax, we'll provide up to $1,500 for you to pass that on to your tenant to help them through this difficult period. I want to make one point very clear to the businesses and workers. For businesses, you'll be able to access a number of these grants. And I ask you to go through Service New South Wales. We have reallocated resources across the New South Wales government to provide that support through Service New South Wales. So if you are questioning what you're eligible for or want to make those applications, you can do that through Service New South Wales. For workers right across the state, you can contact Services Australia. Whether you're in a hotspot area in metropolitan Sydney, we've now expanded that program to anywhere in the state. So any workers who've had a reduction in over 20 hours, you'll be entitled to receive $600 per week, and then less than 20 hours but above 8-hour reduction in your working hours for the week, you'll receive $375. So these packages are in place. For workers, please contact Services Australia, and for businesses, please contact Service New South Wales. I just want to end where I started. That is, I appreciate this is a challenging time. We've put a significant package together to provide that certainty to get our businesses and workers right across the state through this period. We've done it over the last 18 months, and we'll do it again. Thanks.
You said that you want case numbers to be at or around 0 before we're able to ease this lockdown. What modelling has been done to suggest that a 2-week extension is enough?
Remember, we've said the number of infections in the community we want to get down to 0. So if we have cases in isolation, that is less of a concern to us, and I want to make that clear. So the number that would worry us in the last 24 hours is the 24 number, the fact that 24 people were infectious in the community. We need to get that down to as close to 0 as possible. The advice on the 2 weeks is provided through health. We will know at the end of 2 weeks to what extent we need to extend the lockdown, whether there's any chance of face-to-face schooling. There's a number of issues that we won't know until we have further data. And remember, the impacts of some of the changes we put in place won't be felt for the next few days. So it's really important for us to assess all the advice we have, which will be based on data, and that will take us obviously the next 2 weeks to make that assessment. What I don't want to do is provide guesswork to the community. The community deserves certainty, and the community needs to know exactly what decisions the New South Wales government has made. So at every time we communicate something to you, we'll provide certainty. The reason why we wanted to provide that 2-week period at least is so that parents who are teaching children or supervising children from home know that unfortunately for an additional 2 weeks at least, their children will need to learn from home. The Education Department's already put those measures in place. They've already spoken to the Catholic schools and independent schools to make sure those contingencies are there. So what is important for us is to provide as much certainty as possible, but unfortunately none of us have a crystal ball, and our success on getting those case numbers down to all those infectious rates down to as close to 0 as possible depends on all of us and how we respond. And that's why I really want to thank the Fairfield local government area. You've been outstanding. Our data tells us the mobility has reduced significantly compared to other areas. Of the lockdown areas. So thank you to the Fairfield local government area. We now want those same mobility data to be reflected in Canterbury, Bankstown and Liverpool, but across the lockdown area, because we're still seeing cases in the eastern suburbs crop up. We're still seeing cases in the Sydney CBD area pop up. So it doesn't matter where we live or what our circumstances, we just need to stay home unless we absolutely have to leave home, and that's the strongest message. Whenever we have information or advice that we need to update the community on, please rest assured we provide that, sometimes within hours or by the time of the next 11 o'clock press conference. It's really important for the community to have as much information as we do and to provide good context for the community. And we know that if people reduce their movement, please consider what you regard as essential work. Don't leave the home unless you absolutely have to. We know and rely on goods and services being provided to all of Greater Sydney and New South Wales for that matter, but we also know that that carries risk. So when you are an essential worker, please think twice. Do I need to do that work this week? Can I stay at home? And given the financial support available, we really want people to make informed decisions about their movements, especially given we know where the concentration of cases is at the moment. The reason we're putting these additional measures in around testing and the like is because we don't want to set back. We don't want a situation or a number of cases to crop up and then take steam and take off, because we know how contagious Delta is. It's really important for us to contain the cases to those concentrated areas and not have them take off in another area. We can't afford any setbacks. We want to get out of this lockdown as soon as we can, and that's why we've put the settings in place that we have.
Premier, at the start of this outbreak, there were warnings that being slow to lockdown would prolong a lockdown. There were also warnings that not making the lockdown harsh enough would prolong the lockdown. Now that this is happening, should you have made different decisions a couple of weeks ago?
Our decisions are always based on the health advice. I have as many people telling us we went too early as I do as many people telling us we went too late. That commentary will go on, and I expect that to go on. But my job and the job of the government is to make decisions based on the health advice, based on the data, and that's exactly what we will continue to do. And I appreciate people are stressed and upset about what's going on, myself included. None of us want to be in this situation, but it's our job to keep the community safe, as well as make sure we keep jobs going for the future, which is what we've done with our economic package. We've taken the health response and obviously a broader business and economic response through the package, which is really important. But it's really important for us to keep relying on the science and the data, and also relying on people doing the right thing. And we've seen every time we ask people to go forward and get tested, people are responding. We ask people to stay at home in particular areas in particular, and they're responding. But now we just say to everybody, we have equal responsibility. It doesn't matter which local government area you live in, what your circumstances, all of us have to heed to the same advice. And I appreciate there'll be lots of opinions out there, but please know that every decision we take is based on that expert health advice.
Sorry,
I'll come back in a second. Yeah.
You've pushed back the 3-day testing for those essential workers now to Saturday. It was supposed to begin today. We've all seen the long queues out at Fairfield, which are pretty ludicrous, to be honest. Can the government pretty much admit that they were ill-prepared for the amount of people that needed to get tested out there? And are you going to be putting more clinics in place?
Yeah, can I just make this point? If you have symptoms, you should not be going to work. If you have symptoms, go to the closest clinic to get tested and then go home and isolate until you get the result or receive the health advice. But if you are an essential worker or someone who can't work from home and must conduct particular work living in the Fairfield local government area, you can get tested closer to the place of work. If you don't have symptoms and you need to conduct work outside your home, you can't do it inside the house, you can get tested at the closest place to your workplace as opposed to the Fairfield area to take pressure off Fairfield. We accept that people had to wait a long time, and we experienced this as well in the Northern Beaches. But what's important for us is to communicate our decisions as quickly as we can, and then obviously provide that operational support. So the health orders do say that it's not to the weekend that comes in place, but we appreciate a lot of people came forward to get tested, and we're deeply grateful for that. I can't tell you how pleasing it is when we say something and then people respond. And I apologise if anyone was inconvenienced, but please know that response is what we want to see. And to take pressure off the Fairfield local government area in terms of testing, we recommend whoever has symptoms, go to your closest testing clinic, come home until you get the health advice. But if you're a worker who has no symptoms and you have to work and you have to leave the Fairfield local government area, you're able to go to a clinic, there's more than 400 of them, you're able to go to a clinic closer to your workplace to take pressure off. And we just ask everybody to be patient, and thank you for your response. Please know we're working hard to make sure we meet all the demands of the community, and we're keeping in regular contact with our local health districts as well as community leaders to make sure we put resources in where they're needed.
Premier, can you actually put in extra clinics in Fairfield, and could you separate the workers from people who need them because they've got symptoms?
You know, that's why we're saying that if you have symptoms, you should go to your closest clinic. So if you're in Fairfield, you have symptoms, go to your closest local clinic. But if you don't have symptoms and you're a worker who is subject to getting testing to make sure that you don't unknowingly have the virus, you're able to go outside the Fairfield area for that. So for example, if you happen to work in Belrose and you're leaving the Fairfield local government area, you don't have symptoms, you can get tested near the Belrose community as opposed to Fairfield.
Premier, you asked tens of thousands of extra people to get tested yesterday, people who didn't have symptoms. You told them that they would need to follow this rule that was going to be in place from 12:01 today, that they needed a test in the previous 72 hours. You didn't tell them that they could go and get a test outside of the Fairfield local government area. did you stuff it up yesterday in your explanation of the health orders and then your subsequent move to not enforce this until the weekend?
Look, I think the community appreciates that the best thing we need to do is get to the advice to the community as quickly as possible. And then, of course, the operational support is required. And that's why today, based on the health advice, based on the operational requirements, we're saying to ease pressure, and it's not just the clinics and the testing capacity, but the traffic congestion as well. Therefore, to manage all of that, we're saying to people in the Fairfield local government area, if you don't have symptoms and you have to leave the area for work, you can't stay at home and you have to work, you can get tested near your workplace. And that is to take pressure off the system. And, you know, governments and departments and everyone providing the support needs to be flexible and nimble. And we need to be flexible and nimble during this pandemic. We have to respond to what's going on, and we'll always be up front and say it like it is. Liz had an answer. Yeah.
Do we need to look at home testing in Australia to boost the capacity of testing?
There are some exceptional circumstances where that occurs. I think Dr. Chant mentioned that yesterday. I'll ask Dr. Chant to answer that question. Yeah.
We are actively looking at antigen testing and other testing modalities that can be used on scale. At the moment, they're not at the scale. We have great capacity across our system for testing. You've seen those numbers drop up to 65,000, and we've had times where it's 70,000. So I think my key messages would be we are continuing to look at any testing methods which can target people, and we've got different processes in place for close contacts and people that are at highest risk to make sure that they're streamlined and get testing very quickly. But for this surveillance testing, please drop off at a testing clinic on your driving to your essential work or in proximity to your essential work. We actually have got good distributed capacity, and I think that message needs to get out. So please don't get your test in Fairfield. If you have to, first of all, consider whether you really do need to go to whether your work is actually essential. But if it is, get tested as close as possible to that site.
Dr. Chad, you mentioned there's been transmission in workplaces. You don't make that public. What sort of workplaces is transmission occurring, and why can't we define what is essential work? Victoria did it.
So the issue of workplaces is we are seeing transmission in workplaces, and I think we have actually, if you go to our venue, whilst we don't call out when a staff member is at a premise, I think you would see that it's evident when someone's been there for a long period of time that it's most likely to be a staff member. So we are seeing some transmissions, and the areas, it actually is pleasing to see that our exposure venues are the things that people need to essentially go to. So if you look at our exposure lists, people who are unknowingly out and about infectious are turning up at what you'd expect. Supermarkets, chemists, healthcare facilities, and we've put in a range of strategies, and I think I've been clearly messaging about the need to make that shopping purposeful, very quick, in and out, and also to make sure you're wearing your mask properly and you keep your social distance.
Dr. Chant, one of the workplaces last week, one of the workplaces...
The shifting advice with the second AstraZeneca shot, can you confirm for people outside of Greater Sydney what you're advising is at the time frame they should book their second dose?
So the ATAGI advice has always been permissive of an interval, because what the ATAGI advice has acknowledged that what you're doing in selecting that interval is duration of protection versus swiftness of protection. So clearly what we're saying is, particularly in Greater Sydney, I've said openly that if you've had your AstraZeneca shot over 4 weeks ago, contact your GP and talk about bringing that dose forward from the 12-week mark to around the 6 to 8 weeks. But if you're in certain areas where you know you're at even greater risk, down as low as 4 weeks is acceptable. We will be having to vaccinate again against COVID and have further advice in the future about boosters. But in the context of an outbreak, what we want to do is give people the advice so that people are protected. And we know that 1 dose even is helpful in protecting against hospitalisation, but 2 doses is more effective. So my message would be, If you haven't had your dose of AstraZeneca and you're particularly over 60, because we're still wanting to see that coverage in the over 60s get up much higher, please book in for an appointment. And if you're due for your second dose and you've had it over 4 weeks, first dose over 4 weeks ago, call your doctor and see if he wants to bring you in earlier. Our guidance is around 6 to 8 weeks, but in certain circumstances, your doctor might want to do it as low as 4 weeks. So again, our priority around the risk, clearly regional people are also at risk because those communities are at risk of seeding. So basically what we're saying is 6 to 8 weeks is probably a middle ground, and in some circumstances 4 weeks. But in Greater Sydney, our focus is on making it clear that there is a risk of transmission and your exposure is much higher in Greater Sydney.
Dr. Charles, PM said last week that vaccination rates in Fairfield, Canterbury, Bankstown and Liverpool are for over 70s at 48 to 51%, which seems pretty low. Now, I know that the New South Wales Health doesn't have data, the Commonwealth aspect of the vaccination rollout, but for the New South Wales Health aspect of the vaccine rollout, can you give a breakdown of what the vaccination rates are in these 3 LGAs, Fairfield, Canterbury, Bankstown and Liverpool?
So the Commonwealth releases the data on vaccine, so I think that's probably the best place to get the most accurate data. I think they have the source of access to the adult immunisation register, where there is a requirement that anyone who has a COVID vaccine, that data is uploaded. So I think that that's correct, and the Commonwealth would have access to that data.
Dr. Cherry, can I please ask a question? Dr. Cherry, can I please ask a question about hospital access? Has yourself or New South Wales Health provided any overarching advice to the Sydney local health districts about access for support persons during pregnancy? In particular, there seems to be inconsistencies among hospitals and stories coming out about support persons, including partners and biological fathers, being told you can't be there for the pre-labour, you can come for active labour, but then you must leave half an hour after, and in the succeeding days postpartum, you can only visit for potentially half an hour to 2 hours per day. Have you provided any advice around that? Because the local health districts are saying they're following advice from New South Wales Health.
So obviously what we provide is an assessment of the risk around the different areas, and we provide guidance essentially around the levels of personal protective equipment. But the local risk assessment is required to be conducted locally. Those local clinicians understand the risks in their communities, and each case is taken on its merits. But can I acknowledge the impact that has on people? But if there's any specific examples, we'd be happy to follow them up through the local health districts and hospitals.
There's one example of a woman having to labour for 12 hours.
Given that the lockdown's been extended once again, it's very hard on a number of people. Would a singles bubble be feasible?
So currently, the Minister usually answers this question about singles bubbles. But
You can exercise.
But intimate. So basically, intimate partners can visit each other. So just as part of.
But what happens? Sorry, if 2 people, say for instance, are living by themselves, could they have a bubble? One could go visit the other, and vice versa. Would that be feasible?
It's the exercise issue.
They're not intimate.
They're not necessarily intimate.
It's the exercise. I got the question.
2 people can go out exercising together, and as we've said many times before, obviously it's common sense, but just try and be sensible about the way you do it. It's outside and you're exercising, then obviously it's safer in the open air. And as we've said before, if you are referring to partners who see each other in a regular relationship, well, yeah, they can see each other as well.
Sorry, just to clarify, if 2 people are living by themselves and it's very, very tough time, can one go visit the other in that house and vice versa? Could they have a bubble?
We would vastly prefer that if they can, they're outside. Look, this is about just keeping people safe, so let's think about that. That's the starting point. And I think if they can be outside and go for a walk, well, that's better as 2 people would do, because obviously we've said many times the health advice is that you're far safer from getting the virus outside. If that's not possible, then I guess the advice has been all along the line that if you're going to someone's house for care or compassion and you're one person visiting, then it would be better to do it out in the balcony if you have a balcony, or out in the garden. Again, it's just keeping people safe. Just apply whatever you think would be the safest way to try and do it in an open air environment.
You mentioned workplaces, Dr. Chan. Has there been a positive case that you're aware of inside Fairfield Hospital amongst staff there, or any transmission in that setting?
There's clearly, I think, a number of weeks ago where we did have some healthcare staff impacted, and that impacted a number of hospitals, including Royal North Shore Hospital. So I'm not sure if that's what you're referring to. Clearly, our hospitals have put in a lot of protections, and certainly the hospitals have upgraded the PPE requirements for their staff. We're doing all we can to make sure that we keep our healthcare workers safe.
Dr. Chan, just that Bondi apartment block, the Bondi apartment block, is there another transmission case in there, and what's your kind of advice to people living in apartment blocks? 1 million people in Sydney live in apartments.
So I think what we're highlighting is that, and I think I've mentioned this a few times over recent days, is we have issued an order requiring people to wear masks in their common areas. So as soon as they get into the apartment building, they are required to put a mask on. We've also encouraged that strata management and others do not open any of the shared spaces where people may be congregating, because the whole concept of the order, the public health order, is that the household is your exact household, so that there's no opportunities for interactions. So we are concerned to make sure we put in those additional measures so that if anyone inadvertently unknowingly is infectious in an apartment building, that it minimises the spread. Even, for instance, making sure that in terms of journeying up the lifts and other things, that you don't have overcrowded lifts. So all of the precautions you can take to keep those interaction points minimal is important to put in place.
We read this morning that the Treasurer recommended or suggested that you take a 5% pay cut if you recommended an extension to the Northern Beaches lockdown, which turned out to be not essential or not needed. What was your reaction to that when the Treasurer suggested that you take a pay cut?
I have no recollection of the Treasurer making that comment.
Did you, Dom?
No, he didn't. I was there. I've been there all the meetings. It's not true.
There's one site there that's 24 hours testing. Can you make another one that Fairfield Showgrounds 24 hours? Because it seems that you're saying there's not enough capacity for everybody to get tested within Fairfield.
Yeah, look, our message today is obviously we're increasing testing capacity all across those key areas. But our strongest message is if you have symptoms in the Fairfield local government area, go to the closest testing clinic in the Fairfield local government area, get tested and go home and isolate. But if you are subject to the new health orders, which say that you are you're a worker leaving the Fairfield local government area but you don't have symptoms, our recommendation and advice is to go to a clinic closest to your workplace. And these are the reasons. When you have an outbreak within a concentrated area, it's not just testing you have to focus on. You need to focus on good healthcare in the hospital system, in the GP network, on vaccinations, a whole range of things. And if we can reduce the stress at the moment within that local government area on the health system, that is a good thing to do. So this is a decision or an advice we're providing to ease pressure, not just on testing. Testing is one aspect of responding to the pandemic. There's a whole range of other things that take place. The hospital system, making sure that patients who need medical attention are getting the medical attention. But what we do have is enormous capacity throughout the Greater Sydney area for testing. We have enormous capacity, and what we're suggesting therefore is if you don't have symptoms and you must leave the Fairfield local government area for work, go to the closest place or on the way to work or around the place where you work to get tested to take pressure off. That just is common sense. We have so much capacity across the Greater Sydney area. We just want to share the load as much as possible to make sure that people in the health system in particular in that area are not overstretched, and that's just a logical way to respond. And we just want to, and can we just thank everybody for their understanding and their patience in this regard.
I'm
sorry?
On the federal government payment, just a technical question. You suggested that if you're an essential worker, you should think twice about whether you need to go to work. does the federal government COVID disaster payment apply to people who voluntarily decide
yes,
not
that's
to
the
go
whole
to work?
point. The whole point is, if you've had reduced hours, irrespective of the reason, you are entitled to those payments, and that is the whole point. The whole point of us fighting for New South Wales was that people don't have the financial stress of having to worry about getting paid or leaving home. So if you can stay at home, that is the recommendation. If you don't have to leave your house, that is the recommendation. And we ask both employers and employees to apply common sense and to make sure that they get the information. If people need the information about that disaster payment individually, ring Services Australia. The federal government is looking after the payments to individuals, so ring Services Australia if you have any questions about how that might apply to you. And if you're a business, go to Service New South Wales, and that's where New South Wales government is looking after that. So if you have any questions about what it means for you personally in relation to the disaster payments, our preference is, especially if you live in those hotspot areas, not to leave home unless you absolutely have to.
Yeah, just on Wollongong. The last case in Wollongong was 2 weeks ago. It was a close contact. The household originally tested positive 24 days ago. There's been no community transmission at all. Why is Wollongong still in lockdown? I believe Blue Mountains is in place in North.
That's actually a health response, so I'll get Dr. Chart to comment on that.
So what we know is that there is mobile workforces across the whole of Greater Sydney, extending into Nepean Blue Mountains. The reason that cases more recently have emerged in Penrith is because of those work connections. People move about and provide essential services, and they move from the areas across. And so again, last week we had a person test positive who had attended a construction site in Wollongong. So we are concerned that you can get seeding. So until we reduce the burden of the disease in Greater Sydney, we are really still concerned with the mobility, the way workers move around, that will get seeding, and that's not what we want. So that's the basis of our thinking in relation to that risk.
The overnight figures show that there are 2 cases now at the Northern Beaches, obviously the 3rd week in the lockdown. Do you have any further details about those 2 cases in that LGA? So
all I can say is those cases are linked back, and so again it highlights the fact that we have mobile workforces, a really big call out to workplaces. I understand a number of you are critical and essential. We've got to keep the society moving, but it is really important that you institute incredibly safe, COVID-safe practices. And anyone in a workplace, it is so critical that you get tested with the most minimum of symptoms, and that allows us to respond to any workplace, essential workplaces, infections at the earliest possible time.
The HSC, obviously trials will now start in this lockdown period. What's going to happen?
Yeah, look, there are special concessions for Year 12 students, and health and education have been working closely together. And I just want to say to families going through supporting a student doing the HSC, please know that every provision will be put in place, every step will be put in place to provide as little disruption as possible. So the Education Department and Health are working very closely together to make sure that Year 12 can be accommodated. And obviously when every other student is pretty much stay at home. And yesterday I want to report that across the state, in the Fairfield local government area in particular, there are only 1% of students who actually turned up to school. In other parts of the state it was as low as 3 to 5%. So we've seen households responding, and we're deeply grateful for that. But please know, because stay-at-home learning is in place, or home learning is in place, it provides capacity to support HSC students in a safe way. So the Education Department and Health continue to work together, and I just ask every parent and student to follow the advice of their principals. So principals will have a plan in place for their school. Some schools have particular classes or students doing particular subjects. So we just ask our school communities, parents and students to follow the advice that their principal is offering about what their school's arrangements are. And that is the best way we'll move forward.
Can you explain the requirement to maintain staffing levels? Is that jobs or hours? Because some businesses who've crunched the numbers say that save more money cutting employees and shifts than with this support. So what's the incentive for them to keep staff?
The incentive is that workers right across the state who are still on the books can apply through Services Australia for that payment of up to $600 per week. So what we want to see is that connection between workers and the business continue through this lockdown period. So the important part of this announcement yesterday is that if you are a worker who has had their hours reduced but still employed, you can apply through Services Australia for that payment. In addition, the financial business package we put together will enable businesses who are alleviated in terms of the cost to the workers to put those funds into their other fixed costs. So these packages don't work in isolation, they work together, and that's why I want to reiterate the point that the Premier made to people right across our state today, for workers to contact Services Australia and for businesses to contact Service New South Wales, because there are a range of packages available that will provide important cash flow for businesses so that they can keep that nexus, keep that connection with their staff, and also pay for the overhead costs that businesses are facing each and every day during the lockdown period.
Will the criteria for turnover be annualised? Because obviously there are some project-based businesses that will only get paid a couple of times a year, so it's very difficult for them to compare now to back to 2019. So will that turnover decline eligibility criteria be annualised?
So with the reason we've chosen 2019 was because that was pre-pandemic. If we went to last year, you'd have many businesses that wouldn't qualify because they had a loss, a significant loss in revenue. So this is to make it easier for businesses. There are many businesses we understand who are not operating in 2019. And for those businesses, we will work with them in a flexible way to provide a comparable time period so that they can demonstrate and have access to these finances. This is not about being difficult. This is about making this as simple as possible and getting money out the door so every business across the state can get through this period. As I said at the start, there's an uncertain time, but the package yesterday should give absolute certainty to businesses right across the state that there is funding available to help you get through and keep your workers on.
Treasurer, do you support another extension of the lockdown in Greater Sydney?
I support the view that we came to collectively as part of the crisis cabinet. We need to get these case numbers down. I support that decision. And we all members of crisis cabinet have constructive discussions all the time to make sure that our response is where it needs to be. And let's also be clear today, right across the country, we have done incredibly well in keeping people safe, in keeping the virus at bay, and at the same time, on an economic front, our economy today in New South Wales is stronger than where it was at the start of the pandemic. So yes, there are challenges. Yes, there are difficulties and pain across the community right now, but we're going to get through it. The support package yesterday does that. We'll continue to work with health in relation to the advice that keeps people safe across our state.
What's your message to other state governments, in particular Victoria, complaining about the level of support New South Wales has received from the Commonwealth?
Well, I'll say this about the other states, that we have had a very constructive relationship with them, and I want to thank particularly the Victorian Treasurer, Tim Pallas, because in formulating some of the support packages that we've come up with yesterday, they have been instrumental. And the relationship that I have as New South Wales Treasurer with both Liberal and Labor Treasurers, I think has been crucial. They've gone through difficult times in the past in Victoria and in Queensland, and we've always worked together to share information. The Victorian Treasurer is regularly on the phone, offering any services that the Victorian government can provide for the state, and we welcome that. So I've seen our relationship with the other states as very constructive during this time. The reality is they also know that if New South Wales goes well, the country goes well, and we'll always be there to help each other out.
Can you just clarify? So you're saying you never, throughout this pandemic, suggested, formally or informally, that Kerry Tant should get a
I have no recollection of that.
So you've never suggested?
I have no recollection of that. And that's supported by the members of Crisis Cabinet who are here.
I'm not saying in the meeting, I'm just saying outside of the meeting.
Treasurer, can you outline some of the underlying assumptions in this package? Like you said, 4.1 billion, I think, for the business package. How many businesses do you think are going to apply? How many weeks are you budgeting for? And ditto with the individual payments. what percentage of the workforce in New South Wales do you think will be applying
Well,
for it?
a significant number. I mean, we would say that in relation to the weekly access to that $10,000 payment, that over 230,000 businesses right across the state will have access to that payment, and that's both employing business and non-employing business. In relation to the range of packages we put together, we've gone right across the field because we want to make sure that every business is given the support they need, the cash flow they need to keep going during this period of time. And then there is a number of packages, from payroll tax to rent relief to land tax reductions to small business grants to micro business grants. And that's why we say, and I want to keep reiterating it because it's very important, that businesses today or over this period of time contact Service New South Wales to get access to that information and make those applications.
But how many weeks is it going to last?
Well, I mean, what I've certainly done through this period is the increase to the business grants will ensure that extra support for week 3. And with the agreement we've come with the Commonwealth Government is a $500 million support package every single week. And that will be for the duration of the lockdown period. Now, in relation to the other packages, obviously we want to get through lockdown as quickly as possible. And if we do that, then that financial support is there to help businesses with the recovery. So this support is available for everyone right across the state, and we ask them to access it because we know that this will help them get through a difficult time.
In regards to the 3-day testing regime, you've been mentioning this morning that you want to reduce mobility in those other southwestern LGAs. It is a disincentive for people to go to work if they have to be tested 3 days a week. Could you consider extending that to those LGAs, the 3-day rule?
Well, obviously, it's a fact that the vast majority of new cases are in that the Fairfield local government area, which is why, as you've seen, it involves thousands of workers considering their position and those testing requirements. So at this stage, the health advice is limited only to the Fairfield local government area. But that's why we're saying to workers, if you don't have symptoms and you must leave the house to work, please get tested either on the way to your workplace or in and around your workplace. And that is the strongest recommendation. But beyond that, health advice hasn't changed. If the situation changes, obviously, we'll advise the community, and that's why it's important. Both Dr. Chant and I this morning have stressed that the mobility data in Fairfield is looking really good. Please keep that up, stay at home. But we need that mobility limited also in the adjoining local government areas to make sure those areas don't have an event or don't have a situation where suddenly we get another huge cluster of cases, because at the moment it's being contained, which is a positive. The fact that the concentration hasn't changed too much is a positive, but when you get groups of cases in different areas, that's when you start worrying, because then it can take off again. And that's why it's really important. In particular, we called out the Canterbury Bankstown local government area and the Liverpool local government area, and the government is in constant communication with community leaders in those areas, just to stress home to families and also to individuals and to businesses that we really need to see every community step up and do what the Fairfield local government area is doing, which is listening to the health advice.
Victoria is the only other state that's had an outbreak bigger than this or around this same size, same with the length of the lockdown. They've been able to suppress it more than once now, but they've gone much harder. Are you guys seeking advice from them? You know, they've gone through it before. Surely we can follow them.
Look, it's really difficult to compare apples and oranges given the Delta strain and the longer lockdown period in Victoria, but the Victorian government waited far longer than we did to go into the lockdown situation. But I don't think it's fair to compare, because every state has different circumstances and a different way of dealing with the virus. Please know that we've always taken the position in New South Wales that we'll keep the community safe, but also make sure that we keep livelihoods going. We think we have the right balance here, based on the health advice, based on the response we've had from the community, and we'll always base our decisions on the health advice we have.
Back to the comment you made earlier about what we've seen in Fairfield and the queues for testing. You're comfortable with that from what you're saying?
Oh, please don't put words in my mouth. That's not what I said. What I said is we appreciate deeply the fact that thousands of people have come out to respond to testing requirements. If you're a worker without symptoms, you have until the weekend to start that testing regime. But our strong recommendation and advice is that if you don't have symptoms and you must work, our preference is that people don't leave their homes, but if you must work and you don't have symptoms, that you get tested on the way to work or in and around the workplace you're going to take pressure off, not just the testing, because we have enormous capacity across the system. But obviously when an area is getting so many cases at once, it puts pressure on the health system, the hospitals, other social services. So we're just saying, for people to use common sense. We're deeply grateful for everyone for coming forward. Apologise to those who've waited too long. And please know that the advice that we've provided today, we hope will reduce the time people are waiting to get those vital tests.
Is it showing that in 2 weeks we could be at zero, or is the data showing that we will need longer? It is 2 weeks. Yeah. Well, what does the data actually say?
Yeah. Well, I'll ask Dr. Chant to answer that question from a health perspective, but certainly a lot of the data which is predictive relies on human behaviour. It relies on all of us doing the right thing. So I'd love to be able to predict what proportion of our population is going to stick to the rules. We know the settings we have in place are the right settings. What we don't know is what proportion of the population will choose to follow those settings, and that's why I just wanted to thank those people in the community who have really responded. We can't thank you enough because we know the settings work. It's just a question of making sure people respect and follow those settings. And I'll ask Dr. Chan if she wants to say anything from a health perspective.
You must have modelled based on whether everyone follows it or if a certain percentage.
So the key metrics are about mobility and movements, and that's one of the inputs, as well as how quickly we're getting to the cases. And so there's various different models, but all I can say to the community is we need to decrease our movements, particularly in the areas of the southwestern Sydney and in the Canterbury, Bankstown, St George area, Sutherland, that sort of area. We need to take this seriously and really contemplate our need to leave the home. We'll be looking closely at that mobility data, and we've seen some response, but it needs to be better. We need less mobility to get a handle on this. But also within the big picture modelling, there's about our individual behaviours. That's around how we interact with households, and I think we've been very clear. And I would urge anyone who's listening to this to please help us get this message out. We are saying that the stay at home is to stay within your household group. It is not to visit another family member or have another family member in the house. We need to keep the unit of the household as the unit which is staying at home, and that's another driver for the transmission. So we need to decrease mobility overall, but also ensure that we're very much addressing that household transmission risk.
If we need to reduce mobility, Dr. Chan, which you say, which we said, and we now have the financial support package from Mr. Berejiklian for the feds, why don't we have a hard lockdown here?
So So as I've said, we want the community to respond to the financial package, and we want people to... This is a hard lockdown, and I can't stress this enough, that everyone needs to take it seriously as a hard lockdown. We need to see the numbers decrease. 20 infectious in the community at this time is not what I would like to be seeing. So we need to all play our part in taking this incredibly seriously, and please do not leave your home unless it is absolutely essential.
But if fewer people left for essential work, then you'd get the numbers down quicker. If fewer people are leaving their home for essential work, you'd be bringing down the numbers quicker.
Exactly right. We're saying really think about whether the job you're undertaking is absolutely essential. But with all due respect, as Dr. Chant has said, if you look at the facts, most of the transmission in workplaces has been happening in places like supermarkets, which have to stay open, health facilities, which have to stay open, or through mobile workforces. And that's why we've put the rules in place around what we call surveillance testing for workers who are on multiple sites, or for any workers who are leaving the Fairfield local government area. That's why we've put in that extra measure of surveillance testing. If you must leave home, think about it. If you feel that you must leave home, think about, do you really need to leave home to conduct your work? because now with the financial support package in place, people should feel confident. Have a conversation with your boss. The support measures in place, financial support measures in place, are to prevent people leaving home, to prevent people from leaving the premises. But we know that there's essential work carried out, cleaning work, logistics, transporting food and essential services, aged care workforce. Tens of thousands of people leave the Fairfield local government area every day to provide care in aged care homes. We have multiple workforces that have to do their job, and that's why we're saying if what you are doing or undertaking in terms of job is borderline non-essential or doesn't need to happen this week or next week or the week after, don't do it. Make sure you have those conversations, because now what is different today compared to yesterday is these financial measures are in place to keep businesses going. The financial measures are in place to support workers. So if you don't need to leave your home, you shouldn't. Those financial support measures are in place for that reason, so that people can respect both through the health orders but also through common sense, not to leave home unless you absolutely have to. We know we picked up cases through some construction workers. So again, whatever can wait, whatever doesn't have to happen during the duration of the lockdown, shouldn't be happening.
But Freddie, what would you say to a worker at, say for example, IKEA? His boss, this hypothetical staff member at IKEA, wants him to go to work because IKEA is open, because it's not defined as non-essential. So the IKEA boss wants his worker to go to work. The worker can either choose to go to work, which is what his boss wants, or not go to work. What would you say to him?
I'd say look at the health orders. It says stay at home unless you absolutely have to leave the house.
Because there's no definition of what is essential and what isn't essential.
Well, the challenge is, though, which has been demonstrated, right, is that we need to make sure people are able to obtain those things very, very rarely that they need to obtain. But that is why we announced the financial package we did yesterday, to make very certain that unless you're providing essential food or essential services, people should not be leaving their home. And we have relied on the health orders and common sense. You need those two working together. We've seen examples elsewhere in other jurisdictions where it amounted to absolute chaos when you try to define every single occupation. Who would have thought before the pandemic, with all due respect, that a person driving food or essential services from one marketplace would be more essential than lots of other occupations? But that's what we're seeing. The pandemic has changed the definition of what keeps society going. And for that reason, we have confidence not just in the health orders but in the common sense. People know when they're doing the wrong thing. People know when they're conducting work that has to happen. And we just appeal to everybody to apply that. And the vast majority are. We're deeply grateful. But we also know through what Dr. Chant is saying that we need to reduce mobility across the board. It doesn't matter where you live. Do not leave home unless you absolutely have to.
Will you order tools down at New South Wales?
Sorry?
You mentioned construction sites, will you order tools down at New South Wales government construction sites, the Metro, WestConnex?
Well, what we're finding though is people going to the one work site have very safe COVID safety plans in place. What is of concern, so generally speaking, people at the one work site have very safe COVID safe plans in place, and we have confidence that those COVID safety plans are being followed. What is of concern is smaller and medium-sized businesses that have workers going to multiple sites. A tradie, for example, might have multiple sites. So unless the work you're doing is keeping someone alive or keeping someone going, think twice before you leave your house, and that is the strongest message. And if your business is suffering as a result, come to the New South Wales Service New South Wales to get help. If you're an individual person who's experiencing stress because we've asked you to stay at home, please ring Services Australia, where the federal government is providing that support. That is the whole reason why, can I tell you, the Treasurer is being modest today, but the hours Treasury himself and our government spent speaking to the Commonwealth to making sure we got the right package, I cannot convey enough, because we wanted to make sure we had the right package so that everybody is incentivised to stay home. And that is really critical. As Dr. Chant says, we want everyone to stay at home no matter what your circumstances, and now there's the dollars to support you in that decision. But we also appreciate that there are certain occupations, certain movements that have to occur, but those need to be kept to a minimum and done very safely.
Thank you.
Thanks, everybody.
Thank you. Thank you.